I'm here in Greenville now with Dr. Cedrek McFadden as we talk about some of your questions that are coming in on the 7 News Facebook page right now regarding the coronavirus, your medical questions. So I want to start with Teresa. She is asking on the page, I have seen that some people have a rash. Is that common with the virus?
So in one study in Italy, they saw 1 out of 5 patients had some form of a dermatological condition, whether that be like a chickenpox type rash, whether it be a frostbite type rash, or just some sort of a pink rash. And generally what they would do is to treat that as they would any other dermatological issue, topical medications. The concern for any of these rashes when present is what's happening underneath. Is it just that the skin is inflamed, or is there some inflammation of the blood vessels in the skin that's creating that may be a marker for something more serious underneath? So a lot of research happening, especially in Europe, on this very topic right now.
And this gives us a chance to also address the CDC has now widened the symptoms, right? So that would change the dynamic for testing as well. So what are some of the new symptoms?
So they include, along with fever, shortness of breath, and cough, they include headache, sore throat, perhaps a loss in the sense of smell or the sense of taste. They also include chills with shaking, or either muscle aches or muscle pain. And those are in addition to some of these other things we're seeing, such as the swollen toes or these purple or bluish lesions on these body parts that, again, are new to us right now.
And also from C. Henry, he's saying, what about the curve? Have we flattened the curve in South Carolina? What's happening with the curve?
So the overall consensus is that we have flattened the curve, but again, we're still seeing the numbers. That's likely to continue. It may be bumpy. It's not going to be the single spike and things go back to normal. But the overall working thought is that perhaps we have flattened the curve, but we're still seeing those numbers.
Linda is asking, if someone already has coronavirus, what do they do at home to treat it?
So the treatment primarily involves supportive care. That means plenty of rest, plenty of liquids, using over-the-counter medications for fevers or for cough suppression. You also want to isolate yourself from others so that you're not getting infected. And the CDC issued some emergency warning signs, such as trouble breathing or chest pain or confusion, or perhaps there may be a bluish discoloration of the lips that could indicate that you're not getting enough oxygen. Those are things that you need to call EMS for. You don't need to delay on that and seek medical attention if you're seeing any of those emergency signs at home.
And very quickly, as we wrap things up, still no proven FDA-approved COVID treatment?
Still no proven FDA. Lots of trials, lots of tests being done, lots of theories about what could be a possibility, but still no proven FDA medications for this coronavirus.
All right, well, if you have any more questions, you can go to the 7 News Facebook page. We'll ask some more on Thursday. So yes. Dr. Cedrek McFadden, our 7 News medical expert, thank you.
Thank you.